Good day everyone. This is Dr. Shankar, reader from Department of Pediatric and Preventive Dentistry, SRM Dental College, Ramapuram. In this video, we are going to see about the child interaction. This is the periodontic treatment triangle. If you look closely into this periodontic treatment triangle, the child patient is always placed at the apex of the triangle and the parent and the dentist are placed at the bottom of the triangle. This implies that our primary focus should be given to the child patient. And if you look closely, there are few arrow marks that are given in this particular triangle stating that the communication or the interaction should happen in a bidirectional way and with both the child as well as the parent. So a bidirectional communication between the doctor and the child and the parent is vital to successful outcome in the dental office. Ideally, a communication or the child interaction should happen even before the child visits the dental office. And for this, we have something called as a pre-appointment behavior guidance. Let's see what we do in that. In pre-appointment behavior guidance, mainly we should outline what all the procedures that will be done during the first visit, that what to expect and what we do in that particular visit should be explained clearly to the parents so that they'll be able to prepare the child for the subsequent visit. So this is the primary aim of the pre-appointment behavior guidance. To make the communication smooth and the first visit more pleasant, we should ask the parents to avoid following terms like pain, injection, and dentistry should never be used as a punishment. Unfortunately, in India, many parents they use the terms pain, injection, and even threaten the child that if you eat too much of chocolate or if you talk too much, I'll take you to the dentist and then the dentist will pull out your tooth. So these things should be avoided by the parents even for the fun's sake. Instead, we could ask the parents to read out very good books like Going to the Dentist or Max Goes to the Dentist or Sam and Teddy. All these story books are well written and it has a pictorial representation. This makes the child more acceptable towards the dentistry as well as it instills positive dental attitude in children. So next we'll move on to the communication part. So essentially, communication has four ingredients. That is the sender. Sender is generally a doctor, and the message. Message is what we intend to communicate with the child or the parent. And the context or the setting is the place where we deliver the message. And the receiver can either be the child or the parent. So for a successful bi-directional communication to take place, all these four elements are essential and it should be consistent. Without consistency, there may be a poor fit between the intended message and what is understood by the child or the parent. Message. So the first thing to remember while delivering a message is that the child's cognitive development should be taken into consideration. For an adolescents and teens, we can use the regular dental nomenclature. Whereas for younger kids, we have to use euphemism. Euphemisms are nothing but the alternative terms or phrases which we use for the dental nomenclature. Here we have few examples which we can use. So for example, for amalgam filling, we can tell the kids that we are going to give a silver filling for you. So that would be easy to understand by the child patient. So similarly, for dental explorer, we could say that I'm going to use a tooth counter. So on. So for X-ray or the radiograph, we can say that I'm going to take a picture of your tooth. So these are some of the examples of euphemism for the dental nomenclature. So these are very essential to make sure that the message is properly delivered to these younger kids. So now your homework is to think about the languages that can be used for these things like blood, pus, pain, shot, rotten. Another important aspect of the message is that while delivering a message, a dentist should always keep a positive facial expression and body language. See, this is very essential because a positive facial expression and a positive body language will always make sure that, or it boosts the confidence of the patient as well as the parent on the dentist. So there are even studies which states that when the body language conveys uncertainty, anxiety or urgency, a dentist cannot effectively communicate the confidence among the parent as well as the child patient. So it's very essential to keep a positive facial expression and body language while delivering the message so that it will be clearly delivered to the parent and the child patient. Context or setting. So this denote where the message should be delivered. Ideally, a message should be delivered in a separate chamber that is away from the operatory because an operatory may contain lots of distractions. For example, another child crying, rotor sounds. So suppose if a child sees another child crying in the operatory, this produces anxiety and fear among the child as well as the parent that will interfere with the effective communication that we have established so far. So we should avoid giving or delivering the message in the operatory. Hope this helps you in establishing a very good child dentist interaction. Thank you.